So again, it's on-demand, unscheduled access to Permanente physicians. It is obviously asynchronous, and we're available 365 days a year. We work through weekends and holidays because our patients need us. We don't charge anything for it. There's no copay whatsoever. Members can come in and use it whenever they'd like, and they can come back as often as they want. The chat itself lives on a CirrusMD platform, of course HIPAA compliant. So when the member goes to kp.org and they click on the link, they're taken to the CirrusMD site. It's seamless. They don't know that they're leaving kp.org. And it's white labeled to look like a Kaiser site. We have the physicians working from home. They can come into the call center, they can do it from the office. They're short shifts, 2, 4, maybe even 6 hours, but generally we keep it pretty short. And the docs will have a dual monitor setup. So they've got the CirrusMD setup, and they've got Kaiser's Health Connect EMR open. So we're always in the EMR looking at their past medical history, seeing what sort of medical problems they've got, medications, tests, and so on and so forth, so that we can make the most informed decision we can with the information that we're getting from them through the chat. So in terms of service, do people like it? Yeah, they like it. This would extrapolate to a net provider score of close to 70, which should make anybody happy. And it's not surprising, in less than the time that it would take to come off hold at the call center to make an appointment, you can be done with your entire chat. For us, this is starting to become about patient retention. It's a big deal. It's a fiercely competitive market in Colorado, and we don't take anything for granted. We feel like we deliver good care, but this is one of those things that's going to help us succeed. Our nurse advice calls run 35, 40 minutes, and 40% of them end up with an appointment anyway. So if you put a provider who can make a decision and make a disposition and take care of the problem the first time, it ends up costing you less in the long run. The doctors love doing this. The doctors really enjoy it. We pay them the same salary to do this as they get paid in the clinic or in the emergency department. And they do it from home. And there's little that'll please a doc as much as letting them work from home. When they're doing it, they're busy. We staff it so that they're gonna be busy, and that's all they're doing. But there's just something very nice about not having to come into the office for that half day a week or whatever it is. So we can offer new recruits the ability to say, oh, hey, listen, 0.9 of your FTE is going to be in clinic, and 0.1 you can do telehealth. I'd say this, another one of the most common questions I have is why not just, let AI do this? And my feeling is, and please convince me if you've seen something different, AI is not high enough yet to do this, and it will be. This is an interim solution, right? I mean, all the doctors are going away eventually. But it's not there yet. And so for the next few years, I think you put a doctor in front of people right away, and that's maybe the solution. And can AI help us be more consistent? Can AI help us be faster? Yeah, probably. We do find that there is this phenomenon in a few patients that we've seen where they're willing to chat about something that they wouldn't want to talk about. And it's kind of interesting. It's almost like they feel like they've got this air of anonymity or something behind their computer screen, and they're willing to share some pretty intimate stuff. We get a lot of questions about STDs and so forth, concerns about that, and I think there's just a patina of shame still around that stuff that they'd rather not actually face somebody, literally. And so we have to balance that. Again, you have to be safe. You have to deliver safe, quality care. So in terms of behavioral health, I think that there's potential. We can do video visits in the region. Our uptake for video visits has been very low. And there's probably a multitude of reasons for it. There's probably a certain amount of resistance on the provider side, but honestly, there hasn't been a huge surge of demand from it from our patients. It's funny, I was actually at Teladoc, and I was talking to one of the folks at the booth there, And she was telling me that, you know, she gets free access to Teladoc, and she just uses the phone service because she doesn't like to do video chats.